Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation. Well, welcome back. We are back at it after a little break. How are you, Megan?
Yes, I'm good. I've missed our little, we've still talked on the side, but I've missed recording. And actually, I will say it was kind of a nice break. I mean, this is really fun, but we had a good little break in May to kind of get through. I think people call it May-cember, like it's like December, but in May because it's so busy with the end of school. So it was a really wise choice. I feel like that we took a little hiatus last month. How have you been, Roxy?
Oh, it's been great.
Tell the listeners.
No, it's been good. I just think I'm in kind of a season of just trying to figure things out, you know? It's like,
yeah.
Just when you think you got it figured out, life throws curves at you and you got to figure out more. And so anyway, that's kind of, I'm not overwhelmed, but I just feel like I'm anticipating the next kind of
rhythm.
a new rhythm. And anyway, there's an anticipatory tone to my perspective. I feel like right now I'm just like, right now isn't exactly how I want it to be, but is it ever perfect? No. And I'm excited kind of to see where I'm headed and how things are going to kind of shake out with just a lot of areas in my life. So not trying to be super vague, but just like, I don't have anything terrible happening and I don't have anything awesome happening, but there's just.
Well, maybe we'll have an episode coming up where we can share more of that stuff.
Sure. Yeah.
Maybe.
Yeah. What about you? How's life been? You've had some big changes at the clinic.
Yeah, we have. So this episode will go out, I believe on the 12th, but we are recording this right now. It is the 4th and our 2-year anniversary is on the 6th. And so we had a little open house and anniversary party to share the new space because we expanded into the suites next door. So we went from 2 rooms to now we have 5 treatment rooms and an office and a little kitchen and a gym. So we are super excited for the opportunity and potential for growth. And other big news in my personal life is my husband is a public school teacher and he is officially not going back next year. So he wrapped up his 18th year teaching. And we had lots of mixed emotions about that, but we're super excited. And he will be officially joining the clinic. And then also he's starting his own little side business for multiple things. So that's it's exciting and scary and all the things. And so, when we were like, oh, I get all these, like, I bet you're so excited. And it's so interesting to answer that because we are, yet it's very hard, like risk. Oh, it's tough. So anyway, that's what's kind of been going on. The kids got done with school. My son's birthday is tomorrow. So we're getting ready for that. But yeah, May just kind of flew by with everything going on. So, but before we dive into what we're talking about, let's start off with our Tell Us Something Good. Roxy, through all of this, tell me something good.
I this weekend went on a wellness retreat and it was the best thing. It was the best ever. Like,
good.
I can't even describe it. It's so simple. I think people will probably think I'm crazy, like not crazy, but they'll be like, oh, cool, great. But like, I just have a couple of friends from undergrad who just had a vision and went for it and made this retreat. And it's just so good. It's just about taking care of yourself. And it's just 24 hours and it's really simple. And it's in the middle of Nebraska. So who would have thought that would be awesome? But it's just this really secluded little piece of property with a really beautiful little pond on it and sandy beach and they just made it everything I needed it to be. And yeah, so I'm feeling really like I just felt like there was a lot of space. It was all about, I mean, just really for me, it was all about emptying my head and just being in the moment. And something that came up that someone said is like, man, we know exactly what our phone battery is, but do we have that good of a pulse on our body battery, you know?
Yeah.
And I
Yeah.
thought, oh gosh, like that's so true. And so just
Yeah.
like really trying to be reflective and identify just areas that I'm not doing great on and struggling. And so I mean, but it was so good. Like, and that's just obviously
Yeah.
like an event. This has kind of been a theme in my life over the last few months, and I think it's going to continue. Just there's a lot bigger story than what I just said to that. The just little
Sure.
thing, recurring themes and overlapping themes and whatever. But just that idea of
Yeah.
just slowing down. My girls are 4 and 1. And so, just that idea of like,
Yeah.
I mean, I'm gonna miss it if I don't just stop
Yeah.
and slow down and really evaluate what is important and what can I say no to and what do I need to keep and what do I need to get rid of and things like that. So anyway, that
Yeah.
was
Yeah.
really good. So that was like Saturday to Sunday. Um,
Cool.
and so I'm feeling good with that. But
That's
what
awesome.
about, yeah.
Well, and I think when you were talking about like areas, where you say like we could do better. And today I was actually at a workshop for this the women's leadership cohort that I'm in called the Thread, and it was about growth mindset. And so she gave us these different characteristics and or traits, and you had to put them in the category of strength and opportunity. And opportunity were the ones where it's like we could do better in, but instead of saying like I don't do well in these or I struggle with this, it was just opportunity because it's just the areas where we know we have
Mm,
opportunity to do better. And I just loved that perspective and changing that wording because really the theme through all of that, these workshops is like our brain, it's like takes work to reframe, you
mm-hmm,
know?
mm-hmm,
So, but that leads into my tell me something good is I mean, apart from just like excited about my kids like getting through the school year and just super proud of them for all of that. But I had been part of this local women's leadership cohort called the Thread here in Wichita. They also have a branch in Kansas City, and we meet every 2 weeks. And the workshops have just been so life-giving and challenging, and it stretches me. And when I leave there, like I've had so many mixed emotions. Like sometimes I'm motivated, sometimes I'm drained, sometimes I almost feel angry. And sometimes I leave and I look at things and there's certain areas of my life and even in my business, even though we've only been open for 2 years, where I'm like, okay, we gotta upset the apple cart. Like we've got to like, there's definitely some things that I want to change because I realize how it's affecting me. And so, yeah, even though every time we have a workshop, it does take work, it very much has already like had a huge impact in my life. So I'm just really thankful to be able to have the opportunity to do that. And then I said yes to it and committed the time and the resources to be able to do that. So anyway, that's my tell me something good.
yeah, that's awesome.
Well, Roxy and I have back in, well, goodness, we started a certification back in, let's see, was that January, February?
All blending
Yeah,
together. I
it all
can't
blending
remember.
together after the first of the year. The pelvic rehabilitation fertility specialist certification that Dr. Yenny Abraham through her clinic is called Triggered, which is in like the Arlington area in Dallas area in Texas. And she put together the certification because she has been kind of pioneering the work in the fertility world as far as like in for physical therapy, occupational therapists. And she is just a wealth of knowledge and so well educated in this field. And so I had taken last summer her kind of our mini course. And when she announced that she was doing the certification, of course, I jumped on it and I was super excited because Roxy was like, yeah, I'm going to do this too. And it's always fun because we like to get together afterwards and then we could practice on each other and quiz each other and all that stuff. So that's what we have been up to as far as advancing our training and education here recently. And so in May, we went to Nashville and we had the hands-on lab course. And so that was really awesome to get to go and work with other therapists and work with Dr. Yenny and kind of fine tune those hands-on skills. So we just thought this is part one. We're going to share another episode, maybe even two episodes about what this is. A lot of people are like, wait a second, how do physical therapists play a role in fertility? Like it's, even, I mean, there's just, not only potential clients, but providers too, doctors that aren't aware of our role. So I just love being able to share that. And also what I really love the certification is it is so whole body. And once we talk about all the different pieces of this 12-week certification, because this wasn't like just go for a week and a 3 or 4 days, and we're going to teach you these manual skills, and you're going to do these same skills on somebody in a certain pattern over and over again for this many visits, and that's it. That's not what this is. This is a very comprehensive approach to being able to be an active part of someone's fertility journey. And we are one piece of that. And for the common good of a patient, it's good to have multiple people on your team, and not one person is going to be the one to solve your problems. It's really going to be a team approach, multidisciplinary. And that's what I really love about this. So we are going to kind of dive in and talk a little bit about like the working definition for what classifies as infertility, and the American Society of Reproductive Medicine's definition. So we're going to kind of walk through that. And then we're going to tell you what the certification, what the steps are that we went through to get to where we're at. Roxy and I both, the final step is to write a case study report, which we have 18 months to do. And they give us that much time because they want to make sure that we are seeing fertility patients. Like we're not just doing this course and taking a test and being like, okay, you're done. They want us, like the goal of this is we're learning this information and we're applying this information. We are seeing these patients come in, and then we're required to write up a case study so that we can officially get our credentials. So we're both in that process, and we can't wait to talk more about it. So Roxy, let's start off. Why don't you tell us the working definition of infertility?
Sure. So infertility is the inability to carry a pregnancy to term, such as in cases of recurrent pregnancy loss. And that's really about the most basic definition that you're going to find of that. And that's probably what the general public would define similarly. And so anyway, just thinking about like really basic infertility, I think the inability to carry a pregnancy to term. And so that's kind of where we start. But there's a lot more that goes into it than that, as far as defining and as far as the struggles or the characteristics of what's causing that and what we need to look at. It's not just, oh, you can't get pregnant, or, oh, you keep having miscarriages. Like it's so much more than that.
Yeah. So the American Society of Reproductive Medicine has a definition that came out in October of 2023, and it is definitely more complex of a definition. So it looks at infertility as a disease, condition, or status characterized by any of the following. So it lists as the inability to achieve a successful pregnancy based on a patient's medical, sexual, and reproductive history, age, physical findings, diagnostic testing, and any combination of those factors. The need for medical intervention, including but not limited to the use of donor eggs or donor embryos in order to achieve a successful pregnancy, either as an individual or with a partner. In patients having regular unprotected intercourse and without any known etiology for either partner's suggestive of impaired reproductive ability, evaluation should be initiated at 12 months when the female partner is under 35 years of age, and at 6 months when the female partner is 35 years of age or older. So you can see that there's a lot more to that definition. And I think that we're going to see, potentially that continue to kind of like change. And as we know more, because we are just, as Yenny talks about, a lot of the research hasn't caught up to where we're at with, especially in the field of like what physical therapists or occupational therapists can do and supporting somebody in fertility optimization. So that kind of gives us a little idea because it's much more than just like, I can't get pregnant. There's a lot more factors that go into this. But let's talk and share, Roxy, about what we've been doing over the past 3 or 4 months with this certification. And it really was, I think most people in the group didn't realize like how much like information and how much work was actually going to go into this certification, which is really great because let me tell you, there are certifications out there where, yeah, you can call it a certification, but there really wasn't much to it. And so it was actually kind of refreshing to be put in a situation where I was very stretched. I don't know about you, Roxy, but like it challenged my brain because as PTs, like normally if we go to a course, it's somewhat related musculoskeletal, like it's we can get it really quickly. And this went through so many other systems and so many other areas that, yeah, I mean, goodness, we both, Roxanne, had to take a written test, and you would have thought I was taking the boards again because I was like so scared. I don't know about you, Roxanne, but I was just so afraid to fail.
I will say this was the most challenging course, not like not in a bad way. It was like
Yeah.
at both the same time, it was really challenging, but also really refreshing because at this point, I mean, I think when we take courses, we're so immersed in pelvic health that a lot of the pelvic health courses, like we're diving really deep into something we already know something about, but we're just going in deeper, or we know some manual skills, but we're just kind of learning some like a little bit more complex or like a little more detailed, right? And so it seems like lately, that over the past several years in the pelvic health world, I'm learning stuff that I already know a decent amount about, or I'm fairly comfortable with it. But this really just the comprehensive nature of this course stretched my brain in ways it hasn't been stretched in a long time.
Mm-hmm.
And that was very refreshing just to say, okay, I'm learning a lot about this. And
Yeah.
this is something I need to understand and I want to understand. And it is complex. So anyway, I just think that, yeah, really reflecting back on the course, it was like, I haven't been challenged in this way in a while, just to learn stuff that's not stuff that I normally talk about in my everyday life, or
Yeah.
everyday treatment sessions, it seems like.
Yeah. 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 No, I totally agree. It was refreshing. And I think you and I both like opening and running a business. We've been challenged a lot on our business sides of things, but to be challenged again within a treatment, like a way that we treat and bringing on a new specialty to both of our clinics. And also, you and I are both in the same where we aren't going to just say, "Oh, yes, I can do this," and not be good at it. That's my biggest thing, and
Yeah.
that's what I have when I've talked with Yenny is like I I mean, I've taken courses before that, you take a course and you don't really use it. And so I'm not going to like walk around town saying I can do something when I can't do it. So I feel like, especially in this field of fertility, we owe it to patients and or clients that are coming to us to know what we're doing and offer excellence, like we're not just going to go in there and just like willy-nilly it. So let's talk a little bit about what this looked like. Before the course started, we had online like prep work that we watched. I did it before with the previous course I did. And those that hadn't done that course, Roxy, you guys did the same coursework ahead of time. So it was a really good groundwork foundation of just some introduction stuff. So the first couple of weeks, we just kind of got started and worked on some reading through like some live case submissions, that sort of thing. But our first lecture floored us. And I think
Wow.
everybody was like,
I was like, what did I sign up for?
I almost,
I'm
yes,
an
I was just like,
idiot.
Never mind. I'm out. So this was the endocrinology hormone lecture, and it was given by a really awesome doctor. Her name is Dr. Tan, and she works at a clinic in Texas. I'd have to pull the exact name of it, but so it was diving into endocrinology and hormone health. And oh my goodness, let me tell you. But this is what kind of was exciting because I'm like, this stuff we touched on, like on our, in PT school and on our boards to a sense. But this is where that passion comes from, where I really try to say, like, PTs are in OTs too. I can only speak to what our boards were because I didn't take, I'm not an OT, but we are very complex trained. And I think it's forgotten all the things that we are capable of doing. And that's what was really cool is because I was like, oh my gosh, I can do this, but it's confusing the heck out of me right now. But let me just sit with it for a minute. So yeah, that first week was endocrinology. And then in between to the next lecture, we have assignments we have to do. We had to like read research articles, that sort of thing. And then she'd have us like she'd have an assignment and we had to write and answer the questions and everything. So it wasn't like we just sat at the lecture and then that was it. We had assignments afterwards that we had to do, and those were challenging. Those took time.
It was such good accountability though, because I feel like I'm used to, especially after COVID, a lot of our courses, if they're not like in person, they're like work at your own pace and da da da. And I was like, oh wait, there's a due date on this. Okay,
Yeah.
here we are. Let's do this. So it
Yeah.
was so good. It was like borderline annoying because I'm not used to deadlines like that. But at the same time, it was one of those. I was so
Yeah.
grateful. I was so grateful that we would have that lecture and then we'd have an assignment with a due date on it so that I had to dive into it and I had to, like it, I could have put it
Yes.
off and be like, oh, I'll look at that later. I'll, look into those questions when I have time, which is never. So it was good.
Yeah. That was good. Yeah. Definitely. And so that was like kind of over a couple week period there where the questions and things regarding were like still within that endocrine lab. And I'll tell you, when I went back and studied for the test, I mean, I was drawing like diagrams of like the pituitary and the hypothalamus and the thyroid and
And the
all
arrows.
and the arrows and all that, which I think, our next episode, I think it'd be really helpful for us to talk about like kind of a little bit more of like what each one of these, what it entails, so that not only does this fertility stuff is fertility optimization for people wanting to try to get pregnant, but everything that we're learning also crosses into us being able to treat endometriosis, PCOS. That's where I was just like super excited because I'm like, there's a whole population that is going to benefit from all of this stuff, cycle management, nutrition, everything.
Well, and I even think just like for me having daughters and for me being a
Yeah.
female, like to
Oh, yes.
understand this and to say, oh my goodness, our bodies do things for reasons. Like it's not,
Yes.
I mean, even as smart as the medical community is right now, there's so much we don't understand. But even just to try and scratch the surface and trying to understand, and even just, I mean, not just the female body, but also like we're looking really heavy into the female like hormones, the female side. But man, I just thought this is almost practical knowledge. Like why don't we know more about this? Just and that's a whole nother topic. That's a whole nother soapbox. But
Oh,
just like
totally.
why as females do we not is it not just an expectation for us to learn the tip of the iceberg of this, whether you're in
Yes, just
healthcare
the
or not,
basics.
just to
Yeah.
understand our bodies and to understand why we feel certain ways during our cycle or maybe what's happening or make sense of what our bodies are doing. So anyway, that was just
Yeah.
kind of an eye-opening revelation to me of like, man, we are doing each other and ourselves and our daughters a disservice by not just
Yes.
having a better knowledge of the female inner workings of our body.
Yeah. And to that, Roxy, as you mentioned, like with you having daughters and like just like hopefully we can do better and just basic knowledge is it definitely because my daughter is 12 going on 13. And this was perfect timing too, just as watching my daughter go through just the puberty changes and waiting to start her cycle and stuff like that. I think that it really, well, I'd say it was things that I knew, but like really solidified certain choices that I have for her as far as knowing and seeing that when she exercises and she does sports at school, she'll tell me certain things afterwards about how she feels. and how her body feels. And it definitely has played in some choices I've made for her over the summer of that I'm not going to put her in. We had an opportunity for like a strength and conditioning thing in her school, but she's also running. And she's in this really, this time where she's right there. Like her body is changing so much. She's wanting to sleep more, like there's all those changes happening. It's beautiful. And I hate to, as we know how girls can get and their hormones are changing and they can become emotional, but to be able to sit and because I'm educated on it and I know what's happening, that I'm not like frustrated, but I'm like, I know what's happening. I can help her understand what's happening. So anyway, back to that with the exercise, like I know what's going through her body, what her body is going through. And so I've chosen not to add a whole bunch of physical activity on top of each other because she's already active enough that now knowing what we know, like I don't want to shut down her cycle. I don't want to cause the potential right now of shutting that down because she is like, yes, our kids need to be active, but she also needs to have sleep. She needs to have proper nutrition. She needs to have rest. She needs to not be stressed. So I think that's one thing too that we just aren't generally educated on to think about for our kiddos, especially when we have daughters. So anyway, just so cool. And I think that's a whole nother conversation that we can have. But maybe we'll do a whole podcast on that. So if you can't tell, we get really excited about this stuff now that we've learned about it. So after we did, I'm pulling back up our schedule that we had here. So after we did the endocrine and hormones, we did nutrition. And nutrition was, we had a naturopathic doctor, Dr. Danielle, and we probably need, it would be nice to be able to, and we have to follow us on Instagram. Maybe we'll be able to share some of these like tags and stuff. But yeah, she's a naturopathic doctor and she went through nutrition and fertility. So Roxanne, I don't know about you, but that lecture was so refreshing after the heavy endocrine lecture.
I was like, okay, I can talk food. I can talk this. But I mean, it
I
still
know.
was so good. I think I always am, I don't know, I think surprised when I hear nutrition lectures because I definitely don't know anything. I can't tell you stuff off the top of my head very well about like, oh, these foods have vitamin K and these, like, that's not, I haven't dove that far into it, but I just think it's like, oh my goodness, this is so practical. And just her breaking down why as females and with if we're looking at fertility and our body's ability, like why we need certain things and what role it plays and how it promotes different processes to happen. And man, I think I just take for granted the fact that food and what we ingest really is like our fuel, and
Yep.
it's so purposeful. And yet I sometimes just am so nonchalant and annoyed sometimes by having to figure out what I'm going to make for supper or whatever it is where,
Mm-hmm.
man, it could really be an art if I keep letting my perspective be challenged and changed to just say, man, how can I be fueling my family's body? How can I be fueling my body? Like that can get really exciting. And I think it's kind of too bad that just in the speed of life and busyness and I don't know, just
Yeah. Yeah.
hassle, that it sometimes loses its like jazz a little bit. At least for me, I'm just gonna speak.
Yeah. Yeah.
So anyway,
Yeah.
that was so refreshing to hear her just talk about these are things that are really important in a female's season this time.
Mm-hmm. Mm-hmm.
And this is why. And again, it's
Yeah.
like I don't do a good enough job of really making sure that I understand that just generally for me, like as a 4-year-old, what is really important for a 4-year-old right now? I mean, I'm sure all of it is all the time, but just
Mm-hmm.
even like, oh, like that's part of my job as a mom is to help my kids grow, and so
Right.
I don't know,
Right.
it had me thinking a little bit more along those lines, but I liked how she not introduced, but just really set it up to be practical and necessary. And
Yeah. And we can like in our next episode, we'll break this down more. We can talk more about what is recommended as far as like basic nutrition goes, especially if you're in the season of, struggling with infertility and you're trying to get pregnant and preconception. And, I think we could have Kate Morgan back on here. She's the dietitian that we had on previously as a guest who actually just joined my clinic, which is super exciting, and specifically joined it because of the fertility patients. And we want to be able to optimize their nutrition and supplements, because when we look at unexplained infertility, it really we know we're kind of taught like it just means we haven't dug deep enough. But really the basis of really all of this is inflammation. And we know we can improve inflammation when we clean up how we're eating and potentially adding in some supplements. It's one of those things where you could be doing all the right things, but if you're eating Taco Bell and frozen meals, like again, nothing's wrong with eating Taco Bell, but like if you are doing all these really amazing things, but you're eating a whole bunch of processed food, that right there could be one of the main things. And so really what it comes down to is it's like if you're going to invest in your fertility journey, the first thing we need to be looking at are those basics in nutrition and where maybe we have some deficiencies. So that one was just super exciting too, because a lot of it crosses over with some of the stuff that I just went through personally myself with having an autoimmune condition. And that one got me really excited. So after the nutrition, we went into cycle management, and that lecture was given to us by Dr. Nico Skafka. And that one too just got me super excited. Cycle tracking. And, again, so many women, like, we're not taught this stuff. And I wasn't taught this stuff until I decided that it was the right time for me to get off the pill. And I didn't want to have more babies, but I needed to get off the pill because of health reasons. And I went and did a natural family planning course just so I could learn. And I was like, wait a second here. Why was I not taught this earlier on? Because often these days, young women are put on the pill for different reasons. And so then they're put on birth control pill or IUD or shot or whatever. And then like they don't really have to track their cycle. And so we don't even know why we have cervical mucus. But people don't even know why. So
It's just annoying discharge.
I know. Everybody's like, oh, I just got this annoying discharge. I remember going to my doctor and being like, oh, geez. She's like, yeah, it's just normal. And I'm like, what? I didn't even know what it was for. I'm like, oh, there's a purpose for it to change.
And it tells us we can know
Yes.
where we're at. That's what I think is so cool is like, it's not random. And if it is random, there's something
There's an
wrong
issue.
and we got to
Yes.
figure out why it's random. But like
Yes.
really, that's what I think he did such a good job of just making it really understandable. And it kind of hurt my heart that here I am in my mid 30s and I am just figuring this out. Like, what? This has been happening for over half my lifetime. And I like didn't know so much. And so props to anyone who's already on this because man, it just has been an eye-opening experience. And I think it's so cool to see how like our body is clockwork. And I think we've said this before on here, but just that it's factually our menstrual cycle is our fifth vital sign.
Yep.
And that if our cycle is not like clockwork, if it's not in a rhythm and predictable, then something is off. And we best not ignore that and let it just go on and shrug our shoulders like, oh, that sucks. Oh, my mom's is like that. So mine's like that. Or my sister's is like that. Like, no, that is our body actually alerting us. Just like if our blood pressure spiked or, if our oxygen dipped really bad and all of a sudden we didn't have enough oxygen, like we'd be on that real quick. But yet we let these in the medical profession, we're just guilty of, we've been lax in America to just say, oh, okay, yeah, like let's do birth control. That'll normalize it. Or
like, it's normal. Yeah. It's like,
no, part of it,
It's like,
and so,
heavy, painful periods, stuff like that. Like that's not normal. There needs to be more investigation of what's causing that pain. Like, why is this so heavy? Are there fibroids? Like, what's going on? Our cycle, when we have discomfort with our periods, it should be, like you have like some cramps that are manageable. It doesn't stop your day.
Yeah.
Yeah. Like it doesn't stop your day. But if it's, beyond that, but also too, we have to understand like young girls, Of course, in the beginning, it's going to be a little bit more uncomfortable. And I think, naturally just jump to things where you got to remember that with young girls, let's look at how active are they in school? How much stress do they have? How much anxiety do they have? Are they eating? Are they sleeping? Are they drinking water? Are they like all these things? Because we can also influence them, but it takes time and effort. If you're not okay with doing that, then obviously, like, you have to go another route. But I think that, like, personally too, when I had my thyroid storm right before I was diagnosed with Hashimoto's, what cued me off was I had had a regular period, and suddenly my cycle, I did not get my period, and it went 58 days. And in that time, I was like, something's wrong, something's wrong. And I was like, and then I was told at first, like, are you stressed? I was like, well, yeah, I'm stressed because I haven't started my period. I'm not pregnant. And I knew intuitively that something was wrong. And sure enough, finally, I got loud enough about it and pretty much asked my provider that I needed to have a full thyroid panel. And sure enough, we'd found out that I had Hashimoto's. And that moment forward, I was like, okay, my cycle is something that I'm paying attention to. And till this day, every now and again, it might go a little long. And I'm like, ooh, but guess what? That's typically, it like mimics a month to where I had more stress. And then here recently, I actually had 2 cycles that were really short. And that is not like me. And so it just makes me pause and, like, I'm like, okay, I hear you, sister. Like, I know something's going on, but it's a vital sign. It's telling me something is off, and I need to investigate what that is. And for me, it could be that my thyroid is messed up, and again, and I not messed up, but like off, and I need to like look at my labs. But it's just like it's telling me something. And so I think that was like, oh, it was just so good. And I can't wait to talk more about cycle tracking. So
Well, and even just to circle it all the way back to fertility is if your cycle's off and
yes,
you don't ovulate, you're not going to get
yes,
pregnant if you don't ovulate.
right.
And if you don't ovulate, or if you do ovulate, but it's like really delayed, or really, if that cycle isn't rhythmic, then
The egg, yeah.
also it's going to be harder to sustain that pregnancy because our body hasn't had that good build up to
Mm-hmm.
trigger the right hormones to sustain the
Mm-hmm.
pregnancy. And so, really, just to circle it
Yeah.
back to fertility, like that's one of the most
Yeah.
important things of getting
And that, yeah.
pregnant. And so,
Yeah.
and here we are, we just look at it as our period and how annoying that is
Yeah.
and whatnot, but it's like all about that ovulation piece.
Right. And like, as Roxy just said, is pulling it back to fertility, especially like if you're somebody with PCOS and you're trying to get pregnant, the issue is that fertility or ovulation might not be happening, or it might appear to be happening, but it's really not. And I've had a patient with PCOS I was started to see for fertility before, kind of was like right when I was starting this. And she's like, yeah, I do I do the ovulation strips, and it's telling me I'm ovulating. And I was like, okay, but what is your cervical mucus doing? She's like, well, it's thick at that time, thick and sticky. And I was like, yeah, we're not ovulating. And those ovulation tests can be off if we're not also looking at our cervical mucus, our temperature, because with certain conditions, it can cause elevations in different hormones, and that can cause things to appear to be one thing, but they're not. So that's why this certification is so great. It really is a comprehensive of like, why would I have somebody come in and continue to do manual work on them if I'm not looking at those things? Because we got to get that cleared up. We got to figure that out in order for the manual work to do its job. So that's where I get super excited about this certification is we aren't just going to be like, okay, well, cool. Let's let somebody else take care of that. And we're just going to come in and do this hands-on work. We're going to be asking you, like, what day are you on in your cycle? What's going on with your cervical mucus? What's your period like? Like all these really specific things every single time. In fact, sometimes the first appointment occasionally right now, I've been like, we have a patient that's seeing one of the other therapists, and then they get to a point where like, okay, we're doing fertility, and they come to me. And sometimes that first visit is like almost a whole hour of me asking them questions so that I can get a full history of this, like of the whole fertility part of it. So cool stuff. Cycle management. Okay. The next one was reproductive routes. So this was like natural, medicated, and IVF approaches. And that was also like the IVF protocols, which mind blown. I had no idea there were so many IVF protocols. We now have a beautiful chart. So we know what they all are. Excuse me. There are obviously some that are probably used more than others, but I thought that was pretty eye-opening, Roxy, of like, and there's certain IVF protocols that doctors like to use if somebody has PCOS because they want to make sure that they don't have like ovarian hyperstimulation. So yeah, fascinating stuff. That one was,
I just thought IVF was IVF, if I'm 100% honest. I
oh, I
just thought
know.
it
I
was kind
know.
of a cookie cutter thing. Like maybe they dose you a little bit different based on your labs, but I was surprised at just how there's a lot of thought. There's a lot of thought and intention that goes behind
Yes.
what they pick based on your age, based on your presentation, based on your history, just all that I did not know.
I know. Yeah. Same. And I think the cool thing is us being taught how can we assist in fertility optimization if someone's going the natural route, medicated route, and IVF route. We have a role in all of those, and it slightly tweaked for different things, but ultimately all that we can support in all of those. So let's see here. And Dr. Yenny did that lecture. So the next week after that was, well, and we had a couple weeks in between, but holistic strategies. And this was given to us by one of our colleagues, Sonia. And it was just a very beautiful lecture. She is like, oh, she's so easy to talk to and just like so relaxing. And I'm like, oh my
Her
goodness.
voice, I
She's
could put you to
so,
sleep.
I know. I'm like, oh, Sonia, if you're listening to this, oh, we love you. But that one was really kind of how can we set our practices up to fully support again exactly what it said, holistic strategies. So in a sense that lecture was pretty validating, I felt like, for myself, because there's certain reasons why my clinic is set up the way that it is for individuals, because like we see people that come in with trauma, and so setting up our rooms so that the chair's in a specific spot so it's close to a door, and being able to have lights down low and not harsh, and having maybe certain scents for fragrance that is not obviously not like strong, but you know what I mean. And sound machines or music playing or setting an environment and setting a stage for healing. And I know she in her clinic, I think there's yoga practice and that kind of stuff, which obviously you and I both don't have in our practice, but it was just a good reminder of even thoughtful things. Like if you are going to be seeing somebody that might have been going through a lot of fertility, like we're not going to line our hallways with images of, you know, pregnant women, because we are trying to be sensitive to the fact that that could be really hard for somebody. So just really good food for thought. That one was just so like rounded things out. I felt like it was good.
Yeah. I think just even knowing like we are as physical therapists, we are the experts in the musculoskeletal, but we can be very sensitive and we can be very intentional and thoughtful about the nervous system and about just kind of
Yes.
supporting people in other ways besides just treating their physical body. And I think that's
Yeah.
really what kind of validated a lot of really got me thinking, made some changes and stuff in my treatment room and for the better. And so that was good.
Yeah. Totally. For sure. From there, we kind of went on to like additional diseases and dynamics, interdisciplinary collaboration. We went into then just like a business as far as how are we going to bring this into our practice, that sort of thing. And then was kind of wrapped up into like tracking triumphs and, tracking outcomes and documentation and that sort of thing. So really, I mean, that kind of was a rundown of how all that went. And within that, there were weeks between each of them and assignments that we had to do and case studies we had to do, like she gave us a patient scenario and all this information. And then we had to go through and write up, like, how would we treat this patient? So a lot went into this. And we're just super excited to both be able to bring this to our practices and to Kansas. And ultimately, like, just be able to be another support system and another person on the team for women that are going through fertility care, and also be a place that, if they're going into reproductive medicine, and a lot of times those appointments are hard and they're stressful and they might be painful and there's injections, and the body, you get constipated and you have pelvic pain and all of that, like that needs to also be addressed during that time. So we also have just the general role. And I think that when you're going through those treatments, if that's what you're choosing, to do, you don't have to go through it being very like being uncomfortable. It's the same thing as like when you're pregnant and you have pain, don't let somebody tell you like, oh yeah, you're pregnant, like just deal with it. It's the same thing of like when you're going through this fertility journey, if you're having some issues, like we can address that. So we will dive more into kind of each one of these areas. I think that'd be really awesome just because there's just so much good stuff in what we learned. And then also just ovaries and all that stuff. So hopefully this like shed some good light on what this certification is.
I think even just for like not the fertility patient, just for the average person
Yeah.
too. Like I think we're learning it with the lens of fertility and like with the motivation of that. But
Yeah.
man, so like majority of it, I felt like not majority of it, but the very large chunk of it can just be applicable for anybody.
I agree. I mean, I will say honestly, from taking this course and the certification, it has and will continue to probably not maybe I don't complete is a big word, but almost completely change the way that I practice. Because now having this knowledge, it takes the level of care to another level of, when we have somebody come in with a diagnosis or a symptom, it's never just one thing. And even if during treatment you're simply talking about education on menstruation, like people are getting knowledge they didn't have and they're so incredibly thankful for it. So again, just one more step of just really increasing the depth of knowledge to be able to provide care that is exceptional.
Well, and I think too, there's just a contrast. There's a lot of, as physical therapists, we have a lane that we function
Yeah.
out of, but if every healthcare professional stayed only in their lane,
Yeah.
that would be really poor quality care. And so we have our lane, but we also I think really the certification, what it opened really my eyes to is that it's not enough to stay in our lane and just be really good at what we do. We have to have an understanding of how other professions and other parts of the body overlap into our lane too. And so
Yeah.
we're not claiming to be endocrinologists. We're not claiming to be
Yes.
nutrition experts
Yeah.
by any means. Like we're not just claiming to be gynecologists and, be able to do all that. But how big of a disservice is it if we only stay in our lane and we just are indifferent to these aspects of that journey? When
Yeah.
we do have a knowledge base and we do have the ability to understand that better for our patients' benefits and even
Yeah.
help them ask questions because we have the beauty of time with our patients. And so just for them to bounce like misunderstandings or, man, they said this, I wasn't sure. What do you think? And just to be able to say, well, here's what I know. And this might be a good question to ask when you go back, or just to kind of help them advocate and understand themselves better. And in no way do we have to be an expert, but to know something about it is really invaluable to
Yeah.
just better our patients and help them just be cared for better and make that process or that journey more efficient and smoother,
Yeah.
hopefully in any way that we can. And so that's, I think, really what sets this apart. There's a lot of other fertility treatments that are out there that are really just like a manual protocol that's cookie cutter and every patient gets the same thing. And we'll probably dive into some more of just like the
Yeah.
manual, what that looks like.
Well,
But
and
in
that's
no
yeah,
way is it like cookie cutter. Like
cookie
we are
cutter. Yeah.
figuring, like we are assessing different organs and
Yeah.
figuring out, where we see dysfunction and treating that instead of some programs that say do this step first and then this and you have to go in this
Yeah.
sequence and you have to have this many treatments and that's the protocol. And
Yep. Yep.
and it's like,
Yep.
no, that's not, that doesn't jive well with my soul, but
No, no. Well, that's what I was going to say is like that whole piece that we went through those 12 weeks was the lecture piece of it. And then at the end of it was that we went and we did this lab. And that, as we can talk more a little bit about like what that manual work looks like, but that really is us being able to assess the abdominal wall, see how the fascia is moving and just do some local listening, assess lymph nodes, and be able to see, okay, drain abdominal lymph nodes. Like, let's get some movement going with the lymphatic system, working deep through the peritoneum, assessing the uterus, being able to see like different positioning. Is it kind of frozen? Is it not moving? Being able to look at and assess like uterosacral ligaments, mobilizing the bladder, mobilizing the ovaries, and being able to see, is there restriction? And again, like, we're not claiming that we're going to like clog a fallopian tube, but we do know that organs that have movement and blood flow and less inflammation function better. So we'll talk more about that. But yeah, the hands-on work was just so good. And Roxy had, I was like telling her about my first experience with ovarian mobilization. I totally had an emotional response and release, and I was sobbing like a baby. I was like laughing, but crying, and I couldn't figure out what was going on. And they tell you that this can happen. And I was just a mess. And I was telling Roxy about it. And then Roxy was at the course.
And it happened.
And it happened. Yeah. That's crazy,
It was wild. Yeah.
But you're how many how many months postpartum now are you?
18 months.
18 months.
Mm-hmm.
And yeah, there was some restriction there. You know, it's like, we can talk about our own experiences with this, a whole episode on that too, because it's so fascinating. I'm still fascinated by it. And I'm like, okay, I got to get somebody working on me. So
I know, I'm still like trying to unpack what happened.
You got to unpack it. Exactly. And we're not even trying to get pregnant. This is not for us. We don't want to get pregnant, but you realize that these parts of our bodies are not moving, like our organs are not moving the way that they're supposed to, which then that can lead to, if your ovary is not moving and stuck, like, then, when you talk about how you have ovary pain during ovulation or like certain times of the month, it's like, oh, my ovary hurts, or this recurrent lower quadrant pain, that all gets better when you start doing this stuff. So it's so good. If you can't tell, like, we just told, this episode is going to be long. Sorry, everybody who's listening.
Hey, if you just stuck it out to the end with us, like, seriously, message us something.
Yes.
We need to have like a code word at the end. You message us something, we'll put you in like a drawing for something awesome.
Yeah, I was going to say, we need to start sending out, like, we're going to send out some lube, or something like that. We got plenty of packets. We'll just mail you some. So, but as always, okay, awesome. Well, we're going to wrap this up. Join us for part 2. We'll continue the conversation. We would love it if you'd comment, like, rate us on the platforms for podcasts. And we are super excited to be back and to just have guests on again and continue to have great conversation. So thanks for sticking around, and we will be back in a couple weeks. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.